Hello, thanks for tuning in to our post-op nutrition class. My name is Kat Pittikelly, and I am one of the registered dietitians with St. Vincent's Weight Loss Services. If you'd like to follow along to this PowerPoint presentation, you can turn to the post-op nutrition tab in your binder. If you find that you don't have the most recent copy of these slides, you can always call our office at 450-6097 to get a copy of them. And I like this quote to kind of start today's talk. It's not that we make mistakes that matters, it's what we do after a mistake that matters. This, for most people, is very much a learning process, and it isn't important that we're doing things perfectly, but rather that we're making progress, that we're learning from our mistakes, and learning how to do things better moving forward. This is my counterpart here in red, Micah Bestick, and together we are the registered dietitians of St. Vincent's Weight Loss Services, and we are here to support you in your weight loss journey. So we encourage you to call the office, schedule a one-on-one nutrition consultation, come to our post-op classes, because we are here to support you and to ultimately see you be successful. Today we will be covering the diet progression after surgery. That's those first 4 to 6 weeks after surgery. We'll look at the importance of hydration and techniques to stay hydrated. We'll look at those lifelong guidelines to be successful. And then we'll finish the talk with vitamins, minerals, hair loss, and other potential problems. You do have this same timeline under the post-op diet in your binder, and probably if you're tuning into this video by now, you're at least on full liquids. Those are started day 3 after surgery and are continued until 10 to 14 days post-operatively, which is when you can start pureed foods. When you think of pureed foods, think of the consistency of baby food, like something you would spoon feed an infant. You could just purchase baby foods so long as there's no added sugar or added sodium. Or you could just choose foods that are naturally blended, like hummus or fat-free refried beans. Or you could just blend your own foods using a food processor. Most people will be on pureed foods for 1 to 2 weeks before progressing to solid foods. And solid foods, just as the name implies, soft foods, just as the name implies, they have a soft texture, things like eggs, cheese, beans. And then after a week or so on soft foods, most people progress to solid foods somewhere around 4 to 6 weeks post-operatively. One of the things you'll want to make sure to avoid as you're progressing through these solids is that you're not eating until you're uncomfortable. If you start to feel uncomfortable, you are probably either eating too much in one setting, even if your new stomach was only ready for 2 to 3 bites and you took 4 to 5. I know outside of weight loss surgery, never would we consider 5 bites of food to be too much. But in fact, after surgery, especially as your stomach is healing, that might just be too much. Another cause of discomfort would be if you're progressing too quickly through this timeline, or if you're skipping phases altogether. So we do intend for you to follow this timeline and to only advance as tolerated, meaning without having a lot of discomfort. So just to give you guys some more options when it comes to full liquids, that would be like sugar-free, fat-free pudding. You could do some light Greek yogurt. You could do dairy if you tolerate dairy. You could be using your isolated protein supplement along with dairy. You could do soups that don't necessarily have to be broth-based, like when you are on clear liquids. Pureed foods, again, things that have that blended consistency, so things like hummus, This is a mashed sweet potato there in the upper left corner. Those are some refried beans there on the far right, the bottom right-hand corner. Mashed potatoes. Just note that the mashed potatoes you would want to make with skim milk. If you add whole fat milk and butter, that might cause some dumping syndrome, some kind of discomfort there. Soft foods, again, as the name would imply, those are things that would be soft and you could eat easily with just a fork. So no knife required to chop foods with soft food consistencies. So things like well-cooked vegetables, canned fruit, cottage cheese, eggs, beans, all excellent sources of nutrition, which would also follow the soft food guidelines. And again, by 4 to 6 weeks, most people would progress to regular solid foods. And we've given kind of a sample day here of what a day of intake might look like after weight loss surgery. And there in the bottom right, you'll see we've included the plate method there as kind of a reminder that the eventual goal would be to have your plate looking like the one pictured on the right, where most of the plate is made up of vegetables or fruits and vegetables, with just a quarter of the plate coming from your lean protein and a quarter of the plate coming from your whole grains or your starchy vegetables. Of course, you will want to follow your body's own tolerances and stick with foods that are well tolerated. We do hear from many of our post-op patients that some of the starches like rice or pasta, they tend to just be too filling. So if that's the case for you, you could stick to mostly your lean proteins and your veggies. But we show you this so that you can see what a well-balanced meal would look like. Although I should also point out that that plate would be on a saucer-sized plate after surgery, and it would still be likely that you probably could not eat the whole thing, so it might just be 1 or 2 bites of each. And you do want to listen to your body's cues for hunger. So if you're not hungry in the morning for breakfast, that's okay. You know, your body will give you cues. It will let you know when you need the nourishment. Looking at hydration, and really we can't emphasize the importance of hydration enough. Dehydration is the #1 reason that people end up readmitted to the hospital. So this is something we absolutely want to make a concerted effort to stay hydrated. So you should be taking small sips of water from when you wake up in the morning until you go to bed, other than when you're eating or for 30 minutes after eating. Because remember from your pre-op nutrition class that eating and drinking at the same time or drinking too quickly after eating can cause that dumping syndrome, which is highly uncomfortable, but also it can cause food and nutrients to rush through the digestive system too quickly, which can cause you to be hungry again sooner. So this is all about those small sips, but it is important that you're not taking them while you're eating or for 30 minutes after you finish eating. You'll want to do whatever you can to make your water more accessible. So whether that's using a thermos with a straw or water that has a sports top on it, make sure that you have your water with you. If we're not bringing water to our appointments, to work, when we're running errands, then we have very little chances of drinking it if we haven't brought it with us in the first place. You might find that some sugar-free flavorings help you to drink more fluids. If that's the case for you, then fine. Certainly the risks of dehydration would outweigh any potential concerns with sugar-free flavorings, and high sugar drinks like sweet tea or juices might cause dumping syndrome after surgery. but most certainly will provide too many calories to be able to achieve your weight loss goals. So if you tolerate plain water, if you enjoy plain water, I don't think anyone would argue that that's probably the best thing that you could be drinking. But if some sugar-free flavorings help you to get in more water, go for it. The 48 to 64 ounces of water a day is a recommendation that clients frequently receive, although most of our post-op patients find it very challenging just to physically hold that much water. Do keep in mind that those the 48 to 64 ounces, those are total fluid needs, which we get fluids from things other than water. Foods like fruits and vegetables, they provide a good deal of water to our diet, as well as other sugar-free beverages that you might be having. There are some ways to tell if you're dehydrated. The first would be to look at the color of your urine. It should be a pale kind of straw or yellow color. So if it's getting darker than that, you know that you are getting dehydrated. If you're seeing decreased urine output, that's another clear indicator of dehydration. You can also do the skin turgor test, where you pull your skin on your hand up to an elevated position, and if it stays elevated after it's released, then you are dehydrated. So if we know we're dehydrated, what should we be doing about it? Again, sip, sip, sip. You want to make every conscious effort to get rehydrated orally. It might help to set timers to remind you to drink fluids every hour, setting timers either on your phone or through your Outlook calendar at work. Some people find using other forms of fluids like sugar-free popsicles, low-sodium broths, fruits and veggies, again, have fluids, some sugar-free flavor enhancers if that helps you to drink more water. If you've tried all of these and you're just still not able to catch up with your hydration, Monday through Friday, you can call North Florida Surgeons. They do have hydration clinics at all 3 campuses. If it was over the weekend, then you would need to present to your closest St. Vincent's ER. So moving from hydration to our lifelong guidelines, and these, as the name implies, these are things that we intend for you to do forever in order to be successful. The first of which I've mentioned, to avoid eating and drinking at the same time. The second is to eat slowly, remembering that it takes about 20 minutes for the stomach to communicate to the brain that we're satiated. So the quicker that we're eating, the more likely we are to overeat. Also, remember that you have had your stomach manipulated, whether it was with the sleeve and you had 80% of it removed, or with the bypass where your surgeon has created a small stomach pouch that bypasses the anatomical stomach and the first portion of the small intestine altogether, reconnecting with the second portion of the small intestine. So it is important that you are thoroughly chewing your foods. You'll want to make sure that you're chewing. One of our surgeons likes to say, eat like a lady. So we should be eating more like the Queen of England there. Also, using smaller utensils can help you to chew more slowly, or to eat more slowly, that is, because you can't fit a lot of food on such a small utensil. Using the smaller bowls and plates can help you to feel satisfied while eating less. Remember that water is the ideal beverage, and most of us simply need more of it. We do encourage you to avoid carbonated beverages. Most people find that they just are not well tolerated after surgery. And again, we want you to avoid doing things that make you feel uncomfortable. And Micah has been known to call sodas kind of the gateway beverage, because people tend to add in a little bit of soda, and then they're adding in a little of this, a little of that. And next thing you know, we've had a lot of weight regain and we're right back to where we started. Note that we do want you to be caffeine free for the first 30 days after surgery because caffeine increases the risk of dehydration. It is important that you are listening to your body's cues of when you are hungry and when you have eaten enough to satisfy that hunger. So you will want to get in touch with what does hunger feel like for you now that you have had weight loss surgery. From many of our post-op patients, they start to feel slightly nauseous or have a little bit of a headache when they get hungry. Others feel just kind of wilted and lacking in energy, and that's how they know that it's time to refuel. You'll also want to learn what it feels like when you have consumed enough to satisfy the hunger without feeling full or uncomfortably full. I hear from many of our post-op patients that they get that sensation of like, well, I could have another bite, but I don't need to. So that's when they know to go ahead and stop eating. Other people will get the hiccups or a slightly runny nose. That feeling when you sigh, that is us trying to clear more space in order to eat more. So all of those would be indicators to go ahead and get up from the table and to avoid eating more. Another cornerstone in being successful over the long term is to learn to manage the behaviors that got us to this point in the first place. So whether that was the stress eating, habit eating, social eating, mindless eating, emotional eating, we really need to take control of those non-hunger reasons that we eat. Coming to our peer-to-peer support groups and our behavior modification class, as well as our other post-op programming, can be great ways to learn additional insight from post-op patients who have had a similar experience or experiences and have learned to conquer them. Because again, the surgeries will make you physiologically hungry less often, and they will help you to get full much sooner, but they don't impact the more emotional or the more head reasons for hunger. So it's important that we are putting in the work to take control of the non-hunger eating to be successful. And I like this meme, stressed is desserts spelled backwards. Many of us prior to surgery have turned to sweets as a way to manage stress. So we'll need to pick up some new stress management techniques, whether that's practicing deep breathing, guided meditations, or just finding other things that you enjoy doing that help to relieve stress, whether that's reading, going for a quick walk, spending time in nature, attending our stress management classes. And I like this clock here with the eat, 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 think about food, because that's where many of us have been for many, many years. So we need to learn to find other ways to kind of preoccupy ourselves that don't involve constantly turning to food or eating every time that someone else is eating. So ideally, we are choosing mostly the healthy foods pictured there on the right, on the left, rather. Your fruits, your vegetables, your lean proteins, your whole grains, while avoiding the junk foods on the right, the more processed foods, the empty calorie foods, because these are the foods that even if you're eating them in smaller amounts, are still just not contributing anything positive in terms of nourishment for the body and are giving us a lot of excess calories. And if you're looking for kind of a starting point as far as healthy meal ideas and recipes The DASH diet is a wonderful place to start. It stands for the Dietary Approaches to Stop Hypertension. The DASH diet has been proven in peer-reviewed journal articles to be as effective as blood pressure medications for managing blood pressure, and has also been shown to have the wonderful side effect of weight loss. This diet is available for free online. You can just Google DASH NIH, because this was published by the National Institute of Health, and they have free PDF with recipes and meal ideas. Just note that this was not designed specifically for bariatric surgery patients, so it will be far more food than you'll be able to eat in a day, but nonetheless has good meal and recipe ideas. Hair loss is a question that we get quite frequently post-operatively, and know that some initial hair loss is very normal. It is part of the body's natural response to stress, major stress or trauma. So if you're having some initial hair loss, it's probably just the body responding to the surgery in of itself. Whereas if it's more prolonged hair loss, the hair loss that we see at 9 months, 12 months and beyond, that is usually stemming from a micronutrient deficiency, and is because someone's either not adequately supplementing, perhaps they're doing gummy multivitamins, perhaps they're just doing one kind of multivitamin a day. And we're going to look at in a moment the recommended vitamins and minerals. Or when we eat the same foods day after day after day, our body lacks the variety of micronutrients that it gets if we were eating a variety of foods. So do try to work that variety into your diet. Do take your vitamins as recommended to make sure that you're not getting that more prolonged hair loss that's completely preventable. When it comes to taking your vitamins and minerals, you have two basic options. Route 1 would be taking vitamins that are designed specifically for weight loss surgery patients. So the Celebrate or the Bariatric Advantage are the two most simplified regimens that still meet all of the American Society for Metabolic and Bariatric Surgery guidelines. So with these regimens, you would take their multivitamin in the morning, which for Celebrate, it's called the Multi-Complete 45. Or if you did the Bariatric Advantage, it would be the Advanced Multi-EA. These come in chewable tablets, which make your life a bit easier because those first 30 days after surgery, you're not meant to be swallowing things bigger than the size of like a Skittle or an M&M. Note that the serving size, and it says this on the bottle, the serving size for the chewable tablets is 2. If you switch to the capsules when you're farther out from surgery, the serving size is 3, meaning with the capsules you would take 3 at once first thing in the morning. You would wait 2 to 4 hours and then do one of the calcium chews. You would wait another 2 to 4 hours and then take your final dose of calcium. These supplements are available online, celebratevitamins.com, bariatricadvantage.com, or Amazon carries both brands. So if you haven't started your vitamins yet, please get those started as soon as possible. So this regimen is going to be your more convenience-driven regimen because, again, this is the most simplified regimen for meeting all of the guidelines. The disadvantage of this regimen is that it is a little bit more expensive. These supplements would start at about $40 or $50 per month. So if you know that cost savings is important for you, if you're on a fixed income or a budget, then option 2 will probably be the better route for you. This would involve taking just general multivitamins, but you will be taking some supplements individually and you will be taking them more frequently, 4 times a day rather than 3 times a day. So with this option, you would be taking a Centrum for Women in the morning, and then 2 to 4 hours later, you would do a dose of the calcium citrate, which is the Citracal. 2 to 4 hours later, you would do another dose of calcium citrate, and then you would finish the day with another Centrum for Women. Just note the Centrum for Women is the appropriate multivitamin for all patients pursuing weight loss surgery, even men, even women over 50. I know those are populations that wouldn't typically need the additional iron or folic acid, but they are recommended after weight loss surgery. So yes, we do intend for everyone to be on the Centrum for Women. Notice back down at the very bottom of the chart, it mentions the 65 milligrams of iron every other day. And then back up at the top, it mentions additional B1 and B12 once per week. So if it was me, in order to follow this regimen, I would need to have a supplement container with 7 days a week, morning and evenings. I would pick one day of the week, like a Sunday, that I would preload all of my vitamins and minerals. That way I would know when I'm taking the additional iron and when I'm taking the additional B1 and B12. If you do have any prescription supplements that you're not sure if you should continue taking the supplement or just take what's in the vitamin regimen, don't hesitate to call Micah and I. We would be happy to look at those with you individually. And this cost savings regimen would be about $15 a month. We have created a registry at Walmart. So if you go to the vitamin tab of your binder and you look just past this Centrum route, there is a Scantron that you could take to Walmart and they could find all of the supplements required. Many people have the question, well, how long will I need to be on this regimen? They are meant to be lifelong regimens, but of course we will let your lab panels be the ultimate guide of what you need to take additionally or perhaps what you could discontinue. Some of the common problems that we hear of after surgery would be the patients that feel like they're just hungry all the time. Usually this is more of a preoccupation with food. It isn't necessarily a true physiological hunger. It's just that we have become so ingrained that we should be eating, 3 or 6 times a day. We're so used to eating that often, or we kind of see others eating, and so we feel like we should be eating. But usually this is stemming more from a head hunger versus a true physiological need. Other times we will work with patients post-operatively that feel like, well, I'm not hungry, but I'm eating just because I know that I have to. Know that the one thing that all weight loss research has conclusively shown is that we have to create a calorie restriction in order to cause weight loss. So frequently we will see people post-operatively that are truly eating enough to maintain their current body weight just because they feel like they should be eating. So have some faith in your body, have some confidence that it will let you know when it's hungry and when it has had enough if you listen to it. Micah and I also frequently get asked, well, how much am I supposed to eat or drink? And if you could just tell me, how many calories, how many grams of protein, how many grams of carbs. But really, that's kind of like every other diet that we've been on. There's a reason that 95% of all diets fail. If we were all just one diet away from being at a healthy, happy weight, we would have just done the diet and not had to do the surgery. So it's much more important that we're looking at, well, why are we eating what foods, what nourishing foods can we be getting into the body, and how can we eat them in an amount that's satisfying without being overly full. It's just a much more practical, sustainable approach to weight loss, because another thing that comes up again and again in randomized controlled trials of weight loss is that the consistency of our behaviors is what matters. So it's not likely that you're going to be calorie counting and weighing and measuring your foods forever. Like, who wants to do that? But we would expect that you could just honor your body's cues for hunger and satiety and to choose those highly nourishing foods. So kind of our call to action today would be to experiment. Remember that it's trial and error. This will be progress, not perfection. But what really matters is that you're learning from your mistakes, from your past mistakes, and that you're doing things differently moving forward. Take your vitamins, take them as recommended. Make sure you're getting in a variety of foods along with those vitamins, and stay plugged into our post-op meetings. I can't emphasize the importance of that enough, so that you're getting that accountability, so that you're getting that support from people who have had the surgery just as you have. If you need a copy of our most recent post-op meeting schedule, or if you have any other questions, don't hesitate to give us a call at 904-450-6097, or feel free to email Micah or myself. We're happy to work with you and answer your questions. Again, thanks for tuning in to our post-op nutrition class, and we look forward to seeing you hopefully at more of our upcoming programming. Take care.